Mic test 1, mic test 2, mic test 3. Thank you.
Good afternoon again. We're back with our Minnesota Press Corps and the journalists are here. We'll just be taking questions here in just a minute or so. I'm going to be joined by Commissioner Steve Grove, Department of Deed, of course, Commissioner Jan Malcolm at Health, and then Deputy Commissioner at the Minnesota Department of Education, Dr. Heather Mueller. So just laid out a little bit of where we're at, Minnesota. I would reiterate again, while we're in a pretty challenging time in terms of deaths and hospitalizations, there's a lot of reasons to be optimistic. One is that the pause and the work that Minnesotans did have an effect. We're still incredibly high, but that effect is noticeable. And also the vaccines that have started to arrive. We'll start to get into that battle rhythm, if you will, about how we're going to get that out. And we made the focus around the well-being of our children. Trying to strike that balance about Minnesotans' well-being and then trying to provide what's necessary for small businesses. As I said earlier, it's not fair the way this hits because of the nature of how COVID spreads, and our hospitality industries or anything indoor with large numbers of people in close contact with one another are places where we see the community spread begin, and that's where we need to make a difference. Today we're doing something, as I sign this piece of legislation to provide support to those small businesses, this is the way this should be done. This is the way that most nations in the world did it. This is the way we did it back in May when this started, is if you're going to ask Americans or ask businesses to sacrifice for the good of public health, it needs to be accompanied with the economic benefits. When we ask Minnesotans to stay home, that's why that the $1,200 stimulus check was there. That's why we added additional money on top of unemployment insurance. This is a tool that was used everywhere else in the world, and it was used in the early part of the pandemic here in the United States. And then because of the inability of the federal government to move anything, states were left with the task of trying to turn the dials, trying to mitigate the spread of COVID-19 without having the tools necessary to offset the economic side effects that would come from it. So today, this is the way this should be done. And I'll have to tell you, this is what we believe is one of the most, if not the most robust aid package that a state did alone. And so I want to make sure that I give thanks to those folks who made this happen. Speaker of the House, Hortman, Leader Doubt, Leader Winkler, Representative Mahoney, Representative Knorr, and Representative Baker in the Minnesota House did extensive work on this, along with Senator Kent, Senator Gazelka, and Senator Pratt. True compromise, working in the best interest. Commissioner Grove can talk about some of the details, but $88 million in direct payments to restaurants, bars, and gyms, $14 million for convention centers and movie theaters, And then something Minnesota has done uniquely and unlike anywhere else in the country, 115 million roughly for economically significant businesses, including nonprofits, to be distributed by the counties. If you recall the CARES Act money and the help from DC in the first bill back in May, Minnesota gave more of a percentage of our CARES dollars to local states and our cities and counties and kept a smaller portion for the state than any other state in the union. This follows that pattern. These are folks that know best in their community. They have the ability to get them out. So I want to thank those folks for doing that. I'm going to take a second here to sign this piece of legislation. I can tell you we're in the Department of Revenue building. Commissioner Doty has already been, as they were working side by side with the folks negotiating this piece of legislation, getting the things and the staff necessary to start getting ready to process these in as timely a manner as possible to get this aid to folks when they need it. So that is all happening. So I'll just step down, take it, and then we'll come back up and take some questions. Minnesotans proved that we could work in a bipartisan manner, we could work in divided government. This piece of legislation will now be operationalized to get that aid out both to those small businesses and ensuring that unemployment insurance is extended to other businesses. Thank you. With that, I'd be glad to answer some questions.
Governor Walz, Tom Hauser from KSTP. While you say there should be reason for optimism for business owners because of this aid package, the reaction from the industry, especially Hospitality Minnesota and some others, they've used words like devastating, shameful, and unjust. One restaurant owner told me today, allowing them to open outdoors for dining is the equivalent of telling pool operators they can open in the middle of winter outdoors. How do you respond to that?
Well, that move was actually a request from the industry. That was a request from the breweries to allow them to open up outside. Many of those breweries especially have created the space necessary. They said there is a large crowd who does that. There was no belief that that would fix all of them, but that was a request made to us by the industry. Once again,
just to interrupt, so the microbrewery industry, but not the broader bar and restaurant industry, correct? They were not requesting just to have outdoor dining.
No, I mean, I wouldn't make the case. I mean, I live in Minnesota too, Tom. It's cold outside. People don't want to eat outside a lot of time. That was another one of those moves that we made that the breweries and some of these brew pubs wanted to be able to do that. So no, that I certainly, again, if that's not the right thing for your business, you won't do it. And again, I would get back to this. 92 people died today. I was just with and have a list of every single hospital system in the state that says if we don't make these moves, we're going to overwhelm the system. This idea that this is a battle amongst one industry or another is simply a false analogy. This is us as a state fighting against COVID-19. One of the things we're trying to do is to try and provide that relief to them. The fact is, and it's indisputable, that when people are in close contact without a mask indoors next to people who aren't in that family, community spread happens. That just happens to be that industry. So there's no illusion. Certainly outdoor dining isn't the fix to that. Certainly this piece of legislation is enough. The federal government needs to move and do something there, and then we need to get to the other side of this. So again, we're seeing it. People understand this. These numbers are down regardless of if you have a capacity limit. In states that don't have this, reservations at restaurants are still way down. We have to beat the virus before the economy comes back. And as I've said all along on this, it is not fair. It is hitting those types of businesses harder than others. That's why we're targeting the relief specifically to those businesses. Mary.
Governor, what about the restaurants, bars, businesses who have said this week in defiance they are planning to open anyway? The number 100, 200, you know, it could be growing. That's just what we know about. How much do you want them enforced? Well,
Minnesotans know that we're in this together. 15,000 restaurants are doing what they need to do, and they have done, as of millions of Minnesotans making the right call. I certainly want to be clear about this. I think people who are desperate in their businesses, that certainly doesn't make them bad people. I don't believe these are people that don't care about their neighbors getting sick. But the fact is, whether it be inspections for salmonella poisoning or putting on drivers' speed limits, we have these things because it protects the broader good. And so this has been held up. The courts make that determination. We would fully expect, as we've done all along, to talk to people to find a good outcome for that, and get to a space where folks understand. We're trying to provide some support while they're there. We understand that they're hurting. But again, you can't just take off the equation that the United States has the highest number of hospitalizations at any time during this. Our ICU bed capacity, as you heard from the hospital associations and Dr. Holman, is at a critical point. 92 of our neighbors died, and it's not slowing down. So these are mitigation measures we put in. They are painful. We're trying to do everything we can to alleviate that pain, but I fully expect, just as we've done all along here, the vast majority of Minnesotans are making the sacrifice for their neighbors.
Governor, if I could follow up, how are you going to enforce that? Is it going to be state officials, local officials?
The tools that
authorities? I mean, could there be arrests? How, if there's hundreds, are you really prepared to
Mayor, I'm not
enforce it to that
speculating
level?
on that. This is health directives that are put out there. If the number's 200, it's a third of 1% of the folks who've been out there. We'll handle those on a case-by-case basis. The vast majority do it. As I've said all along, it's nobody's intention to try and arrest someone. It's nobody's intention to try and make someone difficult. It's everyone's intention to stop the spread of the virus so our children can get back in school, so that our hospitals are not overwhelmed, and so that all of these other industries are able to continue on and we can provide the support for these folks. So, yes, Dave.
Governor, if you could talk a little bit about schools, or maybe somebody else could, within the classroom itself, this idea that the young kids do not have to be actually socially distanced, will they have to wear masks? And maybe you can talk about the research that led you to the idea that teachers will be extra safe if they wear a mask and a face shield.
Yeah.
Good afternoon. Thank you very much for that question. I think that your first question was really to focus on the student aspect. And from the very beginning in our Safe Learning Plan, when we released it at the end of July, in-person learning always had the component where students did not need to be physically distanced. And so that is one of the pieces that we are going to continue to implement. And we did say, though, that they did need to wear masks. It's part of one of the executive orders. And so they will continue to wear masks, in addition to having their staff wear masks and face shields. And in our partnership with the Department of Health, and I'm sure Commissioner Malcolm would also be able to talk about this, that is one of the mitigating factors that we knew that we would be able to implement in order to ensure that our students continue to remain safe, but so do our staff. We want our students to be able to come back in, and it gives us the opportunity to not only utilize masking and face shields, but some of the other strategies that we know have been successful in other states.
Yeah, if you could, what is the actual data behind the adding in the face shield on top of the mask?
I'm going to let Commissioner Malcolm step up at this one.
Good afternoon. I don't have specific data for you on the percentage improvement or a decrease in transmission with a face shield and a mask. We can see if that exists. But what we've learned from working with other with high-risk settings, such as healthcare and some of the early work we did with some of the large food processing plants, is ways to successfully mitigate even in settings where folks are in close contact with people who are, in the case of healthcare settings, known to be positive, obviously. So there we've learned, just the benefits of that extra layer of protection. So it's an additive layer of protection. I can see if we've got some numeric data for you, but it's really kind of what we've learned as we've gone along in working with other workplaces.
Just one last point of clarification. Is it correct that Fairview actually does have some kind of data and that they shared that with you and that helped inform this?
They may. I'll certainly check into that. I'm not personally familiar with those data, but if it exists, we'll certainly get back to you.
Okay, thank you.
Governor, if I may, You said that the pandemic isn't slowing down, but your own data shows that it is slowing down. Hospitalizations are reducing, cases are reducing. You've been actually prescient on this, saying those would peak in staggered approaches, and that's what's happening. So if it is slowing down, are you sure these are necessary given what the progress that you're seeing?
I didn't say it's not slowing down. I said when I showed the graph that we went from really horrendous to just horrendous. And so the degree of difference there is when you looked at it, and I put that chart out there to show that, because there's a tendency to believe that there's this oscillation that we moved up, we put in mitigation efforts, and we came back down. We've not come all that way, but what we do believe is that we can single out the things where we get the biggest bang for the buck, if you will, on the mitigation efforts, causing the least amount. Again, that doesn't make it any better for specifically bars and restaurants, the place where we can get transmission rates lower and then start to bring that back down. But no, you're right. And here's what I think everybody needs to be clear in the slides I showed earlier. So far at this point, we've got a pretty good understanding of this. And I would say Commissioner Malcolm and Dr. Ostrom were the ones talking about this. If you go back and look at some of your notes, in July, I remember standing right here when Commissioner Malcolm was worried about a November surge that would come right around the holidays, and it might be bigger. What we do believe is probably February, the way this thing has been, that there may be coming back. Now, the variables in that are still kind of hard to tell. We don't know, and it's probably too soon for the vaccine to be making a major impact on that, but maybe some of these mitigation efforts. So what we believe is turning that dial to fit this. The surge is coming down, but it was so incredibly high that we're still in that high-risk category.
Governor?
Yes.
Governor Muriel with WCCO. How are you going to mandate the outdoor seating when it comes to tents? Will restaurants be able to have a sort of covering, or does it have to be completely open air?
No, it's a great question. Across the country, we've seen a lot of different innovations in terms of how to get outdoor seating right. What the health department has stipulated is that outdoor tents are okay so long as 2 of the walls are missing to create some airflow. So if you can have sort of 2 walls on your structures and obviously a roof, but having that side wall removed will help increase airflow and make sure that those environments are safe. There's also a curfew of 10 p.m. in those settings. Tabletops limited to 4. But we know some Minnesota business owners are innovative, and they've found a way to make this work outside. We know for 99.9% of the businesses that will not be an option, but for some it will. And so being congruent with some of the other shifts that we've made, we felt it important to make that possible.
Commissioner, just as a follow-up to that, what about those igloo structures that some of the brew pubs are coming out with? Clearly, those don't have openings on 2 sides. Will that not satisfy the requirements?
Yeah, I mean, it depends on the structure, but if I am imagining what you're describing, you're essentially recreating an indoor environment outdoors, and if there's 4 walls or if it's enclosed, then in fact it wouldn't be allowed under the current guidance.
Governor, Ricardo Lopez here from the Minnesota Reformer. My question has to do with the gyms. I wanted to get a little bit of elaboration on the decision to reopen them at 25% capacity. As you know, gyms have been lobbying and pointing to data that they say showed that they are not a significant source of outbreaks, but MDH has other data. Just kind of a 2-part question. Did any of that lobbying have any impact on reopening them this Saturday? And secondly, is there anything else that your administration can do to be more transparent about?
Well, on the transparency question, we have consistently been rated first of the 50 states in our pandemic data that's out there. We can always do better, I think. The one thing I've noticed, and most of you know how this works, is data doesn't answer the question. It can lead you to the question to ask, and it can also be used in certain ways. And I've seen folks who are saying, and Commissioner Malcolm and I have had this conversation, well, there's a small percentage of folks who get there. Well, the data for us shows that those primary infections are there, and then the secondary and tertiary infections start to spread it out. I think what we've learned during this time is that there's also just the observable aspect of COVID-19. If you are indoors near people who aren't in your family without a mask for an extended period of time, more people are going to get COVID. And so as far as the data, Jan, I don't know if you want to talk about this. We're following it. I would say this, that the data and how we're looking at it is the way almost every other state and nation is looking at it. And interpreting that is there a little bit of difference in how people interpret it? Certainly, I think there could be, but I certainly believe, and again, I would say this about the healthcare industry, I would say it about bars and restaurants, I'd say it about schools and things like that. Nobody's debating that we want to do these things, especially in the fitness industry. Of course it makes sense to want people who want to be in there to be as fit as possible, to do everything they can, but we wanted to see that at that top of that peak, and as the question that got asked earlier is, we think it gives us the ability to make those calculated risks, to turn that dial a little more, to bring them back. As that number continues to drop, turn it a little more. Peter?
Hi, thanks. This might be for Department of Health. We're getting a reaction today from some in the industry, and they all tend to cite their own data. Gyms aren't the problem. Bars and restaurants are very low infection rates. Even social gatherings are low infection rates. Can you respond to that, please? Because they say either you won't give them data or the data you've given them proves their point. And if all that is true, where the hell are people getting infected if in none of these places?
That is a good point. Jan, I'll let you speak about this. And again, trying to use the best data, trying to use the science. And the one thing I would say is Peter articulated a pretty good point about this is, and again, it's not a pejorative about that. Each industry is doing what they're supposed to do. They're advocating for their industry. And again, what we're trying to see is how do we bring all of this and how do we, it's not about prioritizing necessarily, as about figuring out how do we get those activities that we value, our children being in school. We value the opportunity of folks to have private businesses that work, all of those things. And so when we're looking at data, we're looking at that data interacts with one another. So I'm telling you, if we're seeing data that community spread is coming out of indoor seating arrangements, that is going to have an impact on decisions made in schools, decisions made elsewhere. So Jan, maybe you can talk about where we get it and how it's being used.
Well, I think the governor has made the essential points. In terms of transparency of data, I think we put our data out every week, and the disagreement comes around, as the governor said, if you're only going to look at primary cases and say that 1% of all the cases came from known bar and restaurant outbreaks, that's one number. We have said repeatedly that we have a fairly high threshold for what we consider to be an outbreak. It has to be 5 different cases from 5 different households who specifically cite a specific and only that specific establishment. So we know that primary case number even is an undercount. But the more important thing is, as the governor said, each of those primary cases then transmits to some number of other people who then transmit to another number of people. So it's the generations of transmission that we've estimated. One primary case can lead to 70 cases after 4 generations of transmission. So it's just not that original primary case number. But again, as the governor said, it isn't only about, prove to me that you have, that this number of cases is more than that number of cases. There's consistent information that, and it's no coincidence that even the White House Task Force, the very first recommendation they make when counties or localities or states are in the red zone for case growth, that you go to these indoor environments where there is, where people spend a long period of time, where they're in close contact, where they're not masked. And that is the data are abundantly clear that it's the environments themselves that create that risk. It's very, very hard, especially when we've got case growth this high, to precisely attribute, with community spread as it is, to precisely attribute exposures to certain settings. We use this forest fire analogy a lot, but it's because it's particularly apt. In a forest fire, it's very hard to find the hot spot when everything is on fire. So these data arguments about can you prove with certainty that it came from X, Y, Z just get harder and harder to satisfy people with. But the macro level data about the risks of certain environments are certainly, we think, quite compelling and consistent.
Commissioner, a quick follow-up for you looking at data from Wisconsin. They have had a similar decrease in cases and positivity rate as Minnesota without nearly the level of a shutdown of bars and restaurants and restrictions. How do you explain that? Are you convinced it's the bars and restaurants and those things that are causing the community spread?
We certainly think it's contributing. I mean, no one is saying this is the sole cause. It's an amplification of the spread that's out there. And I think it is hard to answer some of those questions about why is this state different than that state. We do know in Wisconsin some of the larger localities have imposed their own restrictions. So it's not the case that there's no restrictions in Wisconsin, but it's not been at the same kind of statewide level that we've had.
Governor, I'd like to ask over here about a couple of apparent contradictions in this order. You've continued to close indoor dining, but to my knowledge, you haven't publicly pressured casinos to close. You're keeping gyms, you're keeping pools closed, but allowing gyms to open somewhat. Can you explain that? Is that a contradiction there? Because that's what it seems like.
Well, there's a lot of conversations on this. And I think, again, going back clear to the beginning, there is no perfect piece to this. With the lack of a federal plan, we follow CDC guidance, White House Task Force guidance. We follow the guidance of our internal experts and those externally. In this case, we run these types of things by everybody in the industry, by the medical folks. And speaking about the pool thing, and again, the one that came up about youth sports versus gyms or whatever, an individual activity with someone separated from someone else for a set amount of time wearing a mask the entire time. That's what the gym situation is. A youth sports situation is large numbers of kids closer together and in contact with one another if it's sports. Now, you can do youth sports that are separated, cross-country skiing, anything like that. Situation with the pool, of the masking, of for a longer period of time. There's no perfect algorithm. There's no perfect, and it got into this. I mean, the commissioner's right. One of the things I would say is not having this strategy, Wisconsin, North Dakota, South Dakota, our numbers are not pure because they're bleeding into one another. That's very clear. I think what you can see is probably the best indicator before this surge was North Dakota, South Dakota, and Iowa and Wisconsin were 1, 2, 3, and 4 in case numbers off the chart. We were 21st. That started to erode and bleed away. And so, Steve, I don't know if you want to talk specifically about some of these, but I can tell you these conversations and apparent contradictions, there's always going to be in this. It's a global pandemic trying to find surge in community spread that's off the charts at a time when we're still learning about that virus makes it, and we have learned. We've moved things since March and doing more things now than we wouldn't have been doing there. And I think folks need to recognize this. If you take the 50 states and the economic activities in the states, Minnesota has always ranked in the top half of states that economic activities are open and functioning. So it wasn't as if this misnomer that things weren't there. So we're always trying to look at those differences.
I think the governor covered most of it. I would just add there is a notion, I think, in all of the analysis of what can be done here on the predictability of the environment. And a fitness center is just different than a youth sports practice because you're not close together. You can predictably separate from one another. I would note that it's not as if we're going back to the way that fitness centers were before. The new requirements require 12 feet of distance between people who are working out. You must wear a mask the entire time that you're there. Fitness classes are not allowed because those classes are, again, more unpredictable and they bring people closer together by the nature of how they're run. So this is a moderated step back into the fitness area. Again, it's kind of the solo workout model, if you will. You mentioned casinos, and we respect the sovereignty of tribes to make those decisions, and that's why we leave that to those leaders and those governments.
Governor, this may seem like a simple one, but it's got some implications. Do you feel like the vast majority of the state still views these orders as legitimate?
Do I believe the
vast majority of the state still views these orders as legitimate? We talk about some businesses planning to reopen.
Yeah, no, certainly. I think Minnesotans understand. They understand the science behind this. I think there maybe been a little bit of a numbness to this, but I don't think we should ever lose track of that. We have the highest number of people hospitalized at any time during the pandemic. We have 220,000 new cases today. Minnesota's reporting 92 deaths. We lost more people in 5 days than we lose in a year on the highways during this. And I think most people recognize that this is real and it makes a difference. And again, I guess it'll be debated, but I'm just going to say point blank, Opening everything up and not doing things like some states did killed people and got more people infected. And I think that is not debatable. And so we've made decisions. Has it been perfect? No. Has it had costs that are associated with it? Absolutely. And I think most Minnesotans believe that's the case. Again, as I've said this, there's certainly no pleasure in doing this. I said if I wanted to tell people what they wanted to hear, it'd be wonderful. You know what we should do? We should just do whatever we want. We should just move our entire caucus to South Dakota and have a super spreader event. I'm not encouraging people to do that. Those are the types of things that have made huge impacts across the country. And let's just be honest as Americans. This has been an abject failure as a nation to contain COVID, because there wasn't a set of rules that were followed, a set of things that we know mitigation works. And if you want to compare that to other nations, it's very simple to do that they took different measures, and those measures involved not only masking, social distancing, it also involved mitigating and shutting down places where the spread was greatest. I will note that most of those nations were able, through their legislators, to quickly and efficiently pass aid packages to support their people. And because of that, here we are 9 months later, 305,000 dead, 18 million infected. Our hospitals are still packed, and we've still got some time to go here. So we are trying to use all the tools necessary, and I just think Minnesotans are pretty resilient people. I've had folks that wanted to give, if you recall, 1st of November, you had elected leaders telling us, this thing is over, open everything up. We've got mobile morgue trucks in California today. They are out of body bags because it came back again. You can't pretend this isn't there, and we do need to have the data, and we do need to put it out there, but all that data and all those numbers and all these decisions come back to, let's use the best we can and the best decisions we can to save people's lives. That's what this was about, and that's what we're attempting to still do.
Governor, I'm wondering if January 10th is it's the next refresh point. I'm wondering if these restrictions could be revised sooner, and what might go into revising those.
And these are discussions. The health people would say, and I think we've continued to say, we need to see where the data is at. I think if the numbers are going, if we get the same response that we got after Thanksgiving from Minnesotans, obviously, you can speculate of why the 10th and what we're looking at there. We think this gives us that quarantine period. It gives us that post New Year's Eve type of thing, post holidays, to let us see where things are at. I believe if Minnesotans do those things, I believe if the trajectory of the troughs and peaks of this pandemic play out, there's a good chance that things will be in a different and better place by January 10th. But like I've said all along, we're going to adjust, whether it's popular or not, to where the pandemic is, and using the best science, the best data, and the best mitigation we can to save lives, reduce hospitalizations, and stop the spread. So I think the timing will be, and again, that's why we're asking. We're recognizing the fact people want to be with one another over the holidays. But I just have to say, we want our kids back in school. We're trying to time that. We want to put the pressure down on this. We want to let the vaccines start to penetrate with large enough numbers. All of those things are coming together at once. The end is, this thing's going to end. This thing's going to end. The question is, how many people get sick and die before that's over, and how quickly we get our businesses back open.
Hi, Governor. I just wanted to ask you about I think you just made a reference to it, but I believe the Minnesota Republican Party is planning on holding a winter retreat in South Dakota in late January, rather than hosting it here in Minnesota. Do you have any reaction to that news?
Well, again, a lot of folks were vacationing out. I have not left the state. There's places you can spend your money here. We know that there's not a great track record amongst that caucus of maintaining COVID. And so I just, again, I don't think it's a wise decision. In an age with technology, we can do a lot of these things. I won't speak to them because I don't know what they're thinking, but I think taking a whole bunch of Minnesotans, especially folks who fall into the high-risk category, and sticking them in a ballroom with no mitigation efforts is a really bad experiment about what could happen around this. And I think it sends a really...
Governor, just following up on that, people are taking their money elsewhere in youth sports. You haven't specifically address that. We do know kids and families are traveling
Folks who
over
can
the
afford
borders.
to probably are. A large number are, I think, simply not.
But we know for sure some are training, traveling, playing in Wisconsin, the Dakotas, going south for sure. I know it for a fact that the dollars and the families are leaving and virus could be coming back and forth. And college sports are going, pro sports are going, and these are big numbers. You know, I mean, 70,000 soccer players, 50,000 hockey players.
Cancellations. Mary, I'd go back to this. I simply can't dictate nor enforce to everybody. What I do know is if you choose to do that, you're putting your family and others at risk. You're making the case. And again, I don't think it makes you a bad person. As I said, I think it makes you a good parent that you want to do these things. The fact of the matter is COVID changes that calculus. So if you simply choose to say, you know what, I think I'm going to do these things, that's how we got into this situation as a country. That's how come we have so much spread in a lot of things. And again, this is hard. This is really hard stuff. And so we're going to try and give people the best tools necessary. Traveling out of state for sports activities or conference things, specifically to avoid or going to states that don't have mitigation places don't have mitigation in place is risky. And I think, again, all the work we're doing, and this isn't me, I just want to be very clear. Every single health system, you receive the letters from them. I'm standing with them. If those health systems were telling me, you know what, you should just tell people that they can go to every bar and that they can just travel and do this, and we got no problem where all our ICUs are good, that's exactly what I would be telling you, because that's the facts that are on the ground. So just to be clear, every decision we make around COVID does have implications, and I understand that. Some of them are very painful about personal things you want to do. They're very painful economically. But there are also decisions that you've heard people stand up here who were firefighters, National Guard, frontline nurses and say, if you do these activities, you're making it harder on me. Please don't make that harder on me as a police officer who has to respond in that. So my advice to them would be is, I hear you. The only thing I could say to all of you is I've got a 14-year-old who I talk to every day about this, wants to be with his team, on a team, wants to play. And we have to explain why we can't. And I know how hard this is.
Governor, getting back to Theo's question about casinos, and I understand the sovereignty issues there, but have you appealed and pressured them to have more restrictions or shut down for their fellow Minnesotans? Because they're also Minnesotans. Have you applied direct pressure to them? Because there's no telling how many people are going to casinos and then spreading COVID all over the state.
Yeah, well, I don't apply pressure on anything with sovereign nations. I treat them as the sovereign nations that they are. We have direct consultations. I share our data. I encourage. I will say that our tribal nations followed along, and certainly early on, in many cases, had better success than we did. There might be some cultural nature around that, about especially for their elderly and their more vulnerable. And they also know very clearly themselves is indigenous nations have been hit incredibly hard because of systemic healthcare disparities. But we do talk to them. The authority for us to be able to make an enforcement, it's not there. These are sovereign nations. These are treaty rights on what they're supposed to do. But we do have great consultation. In fact, we've learned some of our mitigation techniques from what some of them were doing. And so, again, that's the nature of how our system is set up. We encourage them to do it. I think in the vast majority of cases, our tribal partners in trying to mitigate this, because it flows back and forth, have done a pretty admirable job. But that's how we've focused on it.
As a quick follow-up, our education reporter is wondering, are you advocating more testing in schools, especially in the K through 5, in order to get them to be able to open in January?
Yes, and we'll provide it. And I would just use this as a time. Minnesota, we have capacity for testing. You saw that we're asking you, try not to gather if you can, but with an understanding, I want to be with my mom. I want to see my brother-in-law. I want to see my nieces and nephew. One family, masked, separated. Use the testing on this. It's another tool. It's not a get-out-of-jail-free card. Jan, I don't want to get us in trouble on this, but we have this capacity. We can be using it. And when it comes to schools, we are going to do that. Maybe every other week. You want to mention that on the testing? Maybe end with that?
So when we're talking about the testing components, we have been able to work to set up a system where using our service cooperatives, which are 9 different regions, we will be able to test our staff every other week to really help to hone in on making sure that they know that they are continuing to be safe. It helps to identify anybody who is asymptomatic who is coming into the building. Now, one of the things we do know is that this program that we are establishing will begin on January 4th, and it is going to be contingent on us being able to continue to fund it. So we are going to work with not only our state legislature, but also our federal advocates to talk about how it is we can continue to provide funding around that. But we will be doing that throughout the state to ensure that our staff has the opportunity to be tested.
Perfect. Well, thank you all. A lot of questions on these days, a lot of important questions, a lot of nuance around these things, but it boils down to this, folks. We're in a 100-year pandemic that is still raging across the country. Our healthcare providers, to a person across this state, you call them up and you can ask them, are deeply concerned about overwhelming their capacity. We're losing an average of 60 Minnesotans a day, and our healthcare numbers are, that capacity is still incredibly razor thin. We know from science and experience there's certain things we can do to slow the spread. Chief amongst those is to wear a mask, to social distance, to wash your hands. We also know that there are certain activities that make the spread greater. We know that this is painful and hard. We provided, as Minnesotans, you have provided help to your neighbors in these industries and thanking them for helping slow this down by giving them some of that support. This week, a huge change in the dynamics of this started to happen. The vaccines have hit the ground. The virus is now one that we can start to contain. I would caution folks, it's going to take a long time. There's still a lot of unknowns about this to get everyone vaccinated. But as we move down that line will keep coming down. The deaths will start to decrease. The hospital capacity will start to surge. More things can start to happen. And we get to the point where we can do all of these things. Again, you're not going to open the economy if you don't beat the virus. You're not going to have your children back in school and playing sports unencumbered if we don't do this. Just simply pretending it didn't happen or pretending we don't have to do anything and then trying to, don't compare numbers amongst states. Compare numbers amongst nations who've taken different approaches to this because we're all in this together. And that's, I think, the part that I would end with. This isn't us versus an industry. This isn't parsing a number to try and get to a certain place. This is a global pandemic against a killer virus that we've learned much about and have a lot of tools to fight, but we've got a little left to fight. So again, what we're doing today is to try and make those adjustments. You did it during this pause. We came back off that catastrophic peak. We did not see what they're seeing in California. We did not have mobile morgues, and we did not overwhelm our healthcare system, but we walked right up to it. We're coming back down off that. This gets us a ways to turn that dial. Is it frustrating? Yes. Do half the people listening to this want to throw something at the television? Of course they do, because it would be so much easier if none of this was happening. It would be so much easier if the neighbors weren't dying, but that's not reality. And you deserve to have your leadership, your governor, tell you what you need to hear and where things are at, not what maybe we want to hear. So we'll continue to do that, Minnesota. We're going to get through this. We're moving to that new phase. And as I said, that sun is rising. This will be the week of the longest, darkest nights. Next week starts moving towards spring. And that's just where we're at. So thank you all. Commissioners, thank you.
Oh, it's interesting.
Mike's still on there.
What, words do we have to describe? Everything.
Mary?
Yeah.
Mike is still on.
Oh, thank you.